Hi everyone, and thanks so much for your time today. I'm Karen Elliff and I'm the Director of Funding and Partnerships here at Black Dog Institute. I've been here for about 8 years now, and I'm really happy to be presenting to you today on how to pivot and maintain growth in uncertain times, and just take you through the experience that we've had over the past couple of years with COVID. But firstly, I'd like to start by acknowledging Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the lands on which we meet and work. I'm on the beautiful land of the Camaragal people of the Eora Nation, which is here on the north side of Sydney Harbour. And I'd like to pay my respects to elders past, present and emerging, as well as extend that respect to any First Nations people joining us here today. So I thought I would start with a little bit of background on who Black Dog is for those of you who may not know anything about us. So we're a medical research institute dedicated to mental health and the only MRI to investigate mental health across the lifespan, so from childhood through to adolescence and into adulthood. We're a translational research institute, which means that what we learn through our research, we develop into practical programs, treatments and training that we deliver across the community. And our work is aligned to 3 core pillars. Firstly, science. Everything we do is evidence-based. We don't put anything out into the community unless it's been tested robustly and we know it is effective. Secondly, compassion, and this speaks to the way we engage with those people with a lived experience of mental illness, or those who are a carer, or perhaps have been bereaved by suicide. And we embed the voice of lived experience throughout everything we do, from the design of a research project through to what interventions we develop and how we deliver them in the community. Because at the end of the day, there's no point us doing anything if it isn't what those with a lived experience want or need. And finally, action. And this speaks to the translation of our research, the action that we have in the community. And that can be the mental health apps we develop to deliver cognitive behavioural therapy and other traditional therapies. Can be through our online services and websites. We do training programs as well for health professionals, teachers, school students and workplaces. We also do a lot in free mental health resources and self-tests, as well as trialling new clinical treatments and models of clinical care. And also that action extends into our policy and advocacy work that we do with government to improve the mental health system. And this slide is really the why we do what we do. We know that at any given time, 1 in 5 of us will be having a tough time, and that stat goes to 1 in 4 for people aged under 25. Over the course of our lifetime, about half of us can expect to experience some mental health issues at some point, and many of us won't seek help. We know that nearly 2/3 of people don't seek help. Suicide is the leading cause of death between 15 and 44-year-olds here in Australia, and we lose around 58 people, sadly, from the community each week by suicide. And data from the World Health Organization predicts that depression will be the biggest burden of disease on the planet by 2030. Sorry, I see I've put 2023 on that slide. It should be 2030. And importantly, I guess this is relevant for my presentation today. What we're finding is that 80% of people that we've surveyed recently are telling us that their mental health has worsened and that they have increased levels of distress since the pandemic began. So I want to take you on the BDI journey over the COVID pandemic, and this slide won't present anything new to any of you. We were told to stay away from each other, be socially distancing ourselves. Our kids had their schools shut. We couldn't go out to restaurants and see our friends. We had to work from home. Businesses closed down. There was financial distress, and the media showed us daily scary pictures of people in deep cleaning white suits and those daily stats of numbers of cases that were rising and the number of deaths as well. So no wonder then that there'd been an increased feeling of mental ill health and distress amongst the general public, amongst all of us. So what did this mean for BDI, or Black Dog Institute? like everyone, we had to move quickly. First and foremost, we ensured our staff were going to be able to be well set up to work from home, and not just be able to work from home, but be well supported. Being a mental health organisation, that was really important to us to protect our staff. And we were able to have, tap in, I guess, to some of the clinical staff that we have at Black Dog to help deliver online wellbeing activities like mindfulness. We also devised a whole host of online activities like trivia sessions, online coffee catch-ups, yoga, to keep our staff really connected and engaged. And as an exec team, we met every single morning to assess what was going on, because it was a forever changing landscape. But we also had to do a lot of adaptations to our work. Being a research institute, a lot of our work had to be put on hold, which also meant that we had to redeploy researchers whose salaries were funded by government grants, for instance, to other areas of the business. And we had to cover their salaries in that interim period. If you are in research or you access government funding, you'll know exactly that any grant money that the government gives you can only be used for what that grant was intended. We've got on-site clinics at our Black Dog premises here in Randwick, and we had a duty of care to our patients to ensure that we could continue our work with them. So most we were able to move to an online forum and conduct telehealth sessions, but we had to keep our clinic open and clean and safe for those patients who were involved in some of our physical trials. So things like brain stimulation techniques, and we're also doing some really interesting work with ketamine that had to go ahead face-to-face. We have a really large program of workplace mental health training that we deliver to corporates. It's a fee-based service, and it's a very interactive two-way program, and we were delivering that as a face-to-face. So we had to adapt all of our content and delivery to an online format for those programs. We've also have a national program of community and school presentations that we were delivering face-to-face out across Australia, and all of that had to be moved to an online experience as well. And we were getting a huge amount of calls from media wanting our commentary on how lockdowns and COVID were impacting mental health in the community. And then the general public, well, they just wanted information and guidance on how to navigate their mental health and look after themselves during this really unsettling time. So one of the things we did, our very, very clever marketing and communications department saw the value that Black Dog could add as a mental health organisation in helping people to navigate the uncertainty and panic of COVID. And they developed a series called Settling the Mind. And it was a whole bunch of different resources that were created for different audiences, so workplaces, schools, health professionals, and the general public. And they replaced their usually well-planned content strategy with a really flexible one to deal with whatever the changing landscape brought to us on a daily basis, and developed COVID-relevant resources that were free and downloadable. And it really drove a lot of traffic to our website and to our social channels. And from the start of the pandemic until now, we've seen almost 500,000 people come to our website to visit our COVID pages, and 85% of them were new visitors. We also saw a huge increase, particularly in our engagement with content on Facebook. But what did COVID mean for our fundraising? Well, in FY20, just at the start of the pandemic, our total unrestricted fundraising income was around 7.7 million, with over half of it being generated by community fundraising events. So things like City to Surf and Run Melbourne, a whole bunch of cycling events, swimming events, overseas treks. And then we also had a bunch of people just out in the community organising their own fundraisers for us, and they might be galas or barbecues and other gatherings to fundraise. So while we knew we could get through to the end of FY20 relatively unscathed, we were finalising our budgets for FY21 at that time, and we had no idea what the year ahead might look like in the absence of our physical events all disappearing with the lockdowns. I'll come back to this in a little while, but just want to also talk you through another area of our fundraising, which we thought was going to take a really massive hit, and that was our corporate partners. And they represented almost 20% of our unrestricted income at the time. And like everyone else, they were scrambling to get their staff organised, working from home. They were worried about the impacts of COVID to their business model and their income. And they were largely in the dark about what their staff might need from them in a remote working environment. So the last thing that we could really do was to be asking them to support us. We really had to pivot what we were doing and ask ourselves, well, what can we do for our corporates? We really wanted to maintain those strong bonds with them through this period without any expectation of financial gain. So our Settling the Mind series was really perfect for that audience. We had all those wonderful free resources that were being developed. A lot of them were developed for workplaces, and our team became almost like consultants, listening to our corporates and the issues that they were dealing with, sharing information and resources, ensuring they knew about upcoming webinars that would be relevant for their staff or for themselves. Our team was getting in touch with the HR function instead of the CSR function of our corporate partners, with the message really that we're here for you. As I said, we had no expectations that they would be able to donate to us, fundraise for us, or anything else, and we didn't want to talk about that. And it really helped solidify our relationships. And to be honest, I don't think it really impacted our fundraising efforts with them so much in the shorter term. Sorry, I've got a big dog here next to me. And it's certainly benefited us more in the longer term as well. So coming back to the community fundraising, we knew we had to go virtual. We knew that we couldn't survive in the COVID lockdowns without having some fundraising offerings in the market. And every charity was facing the same challenge at this time. So the first thing we came up with was something called the 14 Days Your Way challenge. And the call to action was to come up with your own challenge. It could be something creative that you wanted to learn, or physical, or something else. We left it to the public to decide. And to stay connected to your community through this time, protect your mental health and raise funds for Black Dog. And we approached a number of community members. We had a personal trainer on board, we had a pole dancer, we had an artist to help us create simple how-to content. And we also asked participants to share their own content and do short self-videos so that they could share with us what their 14-day challenge was. We also created just some simple banners and other assets in-house and took on a multi-channel approach, sending our comms out via email to our database, along social media and our website. So how did we go with it? Well, we got around 1,100 signups, including a bunch of people that didn't engage with the fundraising ask at all, and we raised about $40,000. It cost us only a small amount of money in ad spend primarily, and then also staff time. So we still had a positive ROI, but we knew we had to go bigger or have many more events to fill the hole that would be left by our community events not going ahead. In hindsight, the campaign, I guess, didn't have a clear call to action. It left too much up to the individual to figure out what their individual challenge would be. And people, I think, really at that time needed to be told what to do. Life was already difficult enough navigating COVID, and they really just needed something clear and easy. So we went back to the drawing board, and we looked very simply at what was going on in the market. We firstly looked at, well, what are others doing out there? And there were already good virtual campaigns in market. September, of course, was doing a great job, as they had for so many years. We looked at what creative ideas our community fundraisers were coming up with as well. And we had a small group of them who were cutting mullets for a bit of fun and fundraising amongst their friends with us. We also spoke to our corporates and what they wanted. And what they wanted was really to keep their staff and teams connected through this time. And we also looked at what the general public was doing in the middle of the lockdowns. Well, they were walking everywhere, and they were coming to our website and our social channels for that important content about their mental health. So my wonderful community fundraising team, which at the time was a team of just 3, along with my head of fundraising, brainstormed a bunch of ideas, and they came to me with this one: mullets for mental health. And for the benefit of anyone who might not be familiar with exactly what a mullet is, I've put some pictures in there for reference. It's that classic Aussie polarising hairstyle. I was not sure about this campaign at all, but I'm very much someone who loves to surround themselves with people who know much better than I do. And our community fundraising team were really in touch with the community fundraisers, so they knew what sort of things would fly there. So I had to trust my team and really back them on this. The mullet was also making a bit of a resurgence. We were seeing more of them on the footy fields again, amongst the footy codes. And as I said, my community fundraising team was in touch with their community, and it sounded like it could be a proposition that might work. So the call to action was: cut in a mullet during September and get your mates to support you by donating to mental health research. Importantly, though, we know our community fundraisers want to be able to share their story. Many of them we know have a lived experience of mental ill health, and there was an opportunity here for them to be doing something bold, make a statement, get conversations going, which is such an important part of their fundraising motivation. Interestingly, too, it tapped into a demographic which is notoriously bad at putting their hand up and asking for help with their mental health. It was young males. And through the course of the campaign in year 1, we realised that this was a really critical part of the campaign's success. The campaign provided a safe channel for those mostly young men and schoolboys as well to articulate how they were feeling or ask a mate how they were feeling. We took a pretty classic approach, of course, to the campaign. It was multi-channel in its execution. We did paid social media for recruitment, EDMs to our existing database, a good, healthy supply of website content. And we also, luckily, got a fair bit of general media interest. We only had a small budget, so we relied really heavily on user-generated content for sharing as well. And we were able to pick up a couple of influencers in the social media channels too. We automated the supported journeys as much as we could and had some fundraising incentives. And also, we did a post-campaign survey, all pretty standard stuff. So how did we go in 2020? We set really modest goals. As we expected with COVID, we'd struggle to get much traction. People were worried about their mental health. Why would they want to fundraise? So we didn't think we could really attract many participants. But you can see that we blew our goals out of the water. We'd set a goal of having 400 registered participants. We actually got nearly 7,500. And we got a really high active fundraiser conversion. We also had a really high amount of funds raised per participant, and we generated over 3.4 million, which really exceeded our expectations. And unexpectedly, we generated a huge amount of media interest, and we ended up with a total media reach of almost 7.5 million people. So that was 2020. So what did we do in 2021? Well, we wanted to do it bigger and better. We had a much longer lead time to plan for it in 2021, and we were able to justify quite a bit more budget based on what we'd done the previous year. So we engaged a creative agency, which came up with our strapline of showing your all ears for mental health. We also used a digital agency to help us manage and optimize our ad channels. We expanded our social media channels to include TikTok and YouTube, along with Instagram and Facebook, which we'd used the previous year. And we built up a really rich library of content from the 2020 campaign. And so we had a lot of great content to work with. We also invested more heavily in merchandise and implemented things like much better data tracking and reporting, and also put in place a post-campaign survey and things like that. So how did we go in 2021? Well, it went crazy. We almost doubled our participant numbers. We increased the average fundraising per participant, and we raised over 6.2 million. We did spend quite a bit more on the merchandise, on better automation of journeys and increased paid ad spend. Obviously, the more we raised, the more we had to spend on platform fees as well. And still a pretty healthy ROI there, however, of almost 8 compared to 17.2 the year before. The media coverage was extraordinary. We had an estimated potential audience reach of 26 million people, and that was largely through organic media taking up, radio, television appearances, getting traction in areas we had never seen before. So mullets met the needs of that new young male demographic, but for our corporate supporters and the broader community offering, we developed One Foot Forward, which was a virtual walking event. It appealed to the broader community, really engaged workplaces, families, teams, and it was slightly skewed toward women. We found we had more women participants than men. And it really addressed the needs of what our community and corporates wanted during COVID. And we really honed in on those messages of solidarity, being together, connecting in the community, staying connected. And we engaged a digital agency for the campaign development and execution. And they helped us really end to end to execute that campaign. So in 2020, how did we go? Well, again, we'd set really modest targets, and we blew those out of the water. So our income target, we ended up, basically tenfolding that one, attracting a huge number of participants, and importantly, a lot of workplaces as well. So that was 2020. In 2021, we'd learned a lot in the way we ran the campaign in 2020, and this helped us streamline a few things. So in 2021, we refined our journeys and our comms, in particular for our corporates and workplaces. We introduced a robust merchandise incentive model where people could collect their merchandise based on achieving certain fundraising targets. We expanded our recruitment through various channels, so increased our ad spend. We also had the benefit of an out-of-home corporate partner who was able to give us a substantial amount of pro bono ad space. We were still in lockdowns around the country at that time, so I'm not quite sure how many people saw that, but I think it still did give us traction with people that were out and about walking. Importantly, we also hired a campaign manager. We delivered the campaign completely with our existing team in 2020, and it really stretched the team to capacity. We also worked much more closely with our internal marketing team to support the campaign so that we had a really collaborative, holistic approach from Black Dog. And we also enlisted several volunteers to help, in particular, with managing the huge volume of inquiries that these campaigns had generated for us. So how did we go in 2021? Well, year on year, we increased the number of participants by about 40%, which was huge, and increased our inquiries substantially as well, inbound inquiries. Importantly, having a more streamlined approach to our workplaces really paid off, and we increased that to having almost 1,000 workplaces participating. Overall, we almost doubled our income to 11.4 million almost. It was a more expensive campaign to raise, but again, a really good ROI on those funds. So what were the impacts overall on our unrestricted income? We'd had really good growth between 2014 and 2020 of around 30% on average per year. In FY20, as I said earlier, our unrestricted funds were about 7.7 million. In FY21 and FY22, this skyrocketed to growth of around 185% in those 2 years alone. And at the end of FY22, our unrestricted income was around 27.5 million. So we'd nearly quadrupled what we were doing. As we all know, it's so much more than just about the funds raised. And one of the things that we really quickly learned is that fast growth is a double-edged sword. So in those 2 years, our database grew from 300,000 constituents to 800,000. And that was a huge amount of data to import, to clean, to dedupe. And it took months and months to get it all into Razor's Edge NXT. That amount of data also made for more complicated segments and journeys, and we had, as you'd be aware, a huge amount of third-party donors off the back of those two campaigns. And we all know that they're not the warmest of supporters. They're really hard to convert to other programs. But what it has done is it's given us massive opportunities to test our data with various comms journeys and messaging and length of journey to see what segments respond to different asks and how we can try to crack those third-party donors. It put enormous pressure, though, on a fairly small fundraising team. You know, we were a team of probably, I guess, about 15 or so in 2020. We grew to a team of around 30. And during the campaigns, we were really unprepared for the huge volume of inquiries that the campaigns would generate. In the peak of the campaigns, when we had them both overlapping in 2021, we had over 7,000 inbound email inquiries, which meant that we had to divert team members away from other activities and other fundraising to help with those campaigns. As I said, we also recruited and trained volunteers, and everything was really urgent and last minute. And, no matter how much planning we did, we still really underestimated the tolls it would take on the team, and it did cause a fair bit of burnout. A major benefit for us, though, was that the larger unrestricted surplus that the campaigns enabled really gave Black Dog the ability to invest in some great strategic research initiatives, which was fantastic. But the rapid growth that was there in fundraising, as I said, we grew from around 15 people up to, in excess of 30 in those 2 years. It also put enormous growth on the rest of Black Dog. It put pressure on our processes and systems, our HR team, our finance team, our IT. So we really had to play a lot of catch up in those 2 years as well. And to some extent, I guess, it also created an expectation across the organisation that we would continue on that same growth trajectory into the future, when really I think what we had was just a perfect situation for a couple of years there. So what were some of the lessons learned? Well, I guess what we did know was that we needed to be nimble and flexible in a really challenging climate, and I think we definitely were that. I think one of the other lessons was really that, drawing from what you already do well, for us that was community fundraising and community engagement. They were our strengths, and we knew that we could draw from those strengths. And so for us, those sorts of campaigns really made sense. I think very much trust your teams in times of uncertainty. Leaders won't have all the answers. It's your teams that are really close to the ground and really hearing what their community and their stakeholders are saying. So really trusting them is really important. As I said, with our first execution of the 14 Days campaign, remembering the importance of a really clear call to action, something really simple is going to resonate best. And as best you can, prepare for possible overwhelming success. I think this really caught us off guard. While we hoped for success, we hadn't really thought through what executing really big campaigns with lots of participants would involve. And I think it's really about harnessing opportunity. COVID really created for us a, sadly, perfect environment. Everyone was isolated. People were feeling the mental health impacts of what that was. They looked to Black Dog for answers, and we crafted fundraising opportunities that helped to harness that. And I think, one of the biggest lessons learned as I said earlier, is that fast growth is not at all sustainable. It can't last forever. So where are we today? Well, over the past few months, we've seen CPI go through the roof. Interest rates have risen to levels we haven't seen in years. On top of that, people are getting on with their lives again. They're socialising, they're eating out, they're travelling again. People are spending what disposable income they have on a normal life. For 2 years in lockdown, we didn't have many ways that we could spend our disposable income. So fundraising and putting money into the community and doing something meaningful was really, really important. And what this means is that it makes for a really tough fundraising market moving forward for all of us. So what is BDI doing? Well, our 2 campaigns are currently underway. They're doing really well, but not quite the same as last year. And we feel like we're returning to a more normal growth pattern again, perhaps landing on a 30 to 40% per annum growth this year. We're continuing to invest in all of our fundraising streams, in particular protecting the ones that are doing really well for us currently and playing to our strengths. And for us, that's our philanthropy, our corporate partners, our regular giving program. But we're also investing across the board to make sure we're protecting all of our income streams. We're focusing on retention and continuing the testing of various journeys. We're also looking at new income streams. What new streams can we be planning for now to put into effect in the next couple of years? And we're still trying to crack those third-party donors. But I guess most of all, we're doing what is the only thing we all as fundraisers can do in the current climate, and that's really just keep calm and carry on fundraising. I wish you all the best of success and luck in the coming couple of years, which could be quite challenging, and advise you to really look for the sweet spots and those small opportunities in your organisation's mission and your fundraising to create that perfect sweet spot. So thanks so much. Feel free to get in touch with me. It's been a pleasure talking to you, and really wish you well over the next couple of years.